All right. Well, this afternoon we have team coverage on the Johnson & Johnson vaccine. And since that bombshell announcement this morning, we have gotten a lot of questions from viewers, many unsure, of course, about the overall safety of the vaccine and concerned. Joining us live to break down what you need to know moving forward is Dr. Ohm Deshpande, VP Population Health and Clinical Financial Services and the Associate Chief Clinical Officer at Yale New Haven Health. Doctor, thank you so much for being with us.
Thanks for having me, Erin.
So I think a lot of us woke up this morning and were pretty shocked to hear this news. Also, interesting that it was only women who have experienced these blood clots, 6 of them, in fact, between the ages of 18 and 48. So that brought about the question, do we know if any of these women were on birth control? And if so, could that in particular have made things worse?
It's a great question. That's, I think you went to exactly the question that many people asked. And it does seem like in the case of those 6 cases, none of them were actually on oral contraceptives of any sort. It does appear that I think one lady was on hormone replacement therapy, which is a little different, but people on regular birth control were not. It does not appear that that was a factor to any of these issues.
I know that the FDA and CDC are still investigating, but is there any common denominator so far between the 6 women?
Yeah, other than the fact that they're women, there's really nothing that we know right now. And I think they're taking advantage of this pause to see if there are any other cases, and if, to do that due diligence to really get into it a little deeper to see if there are certain people who are at risk. And on the other side, are there other people for whom this is actually safe?
There are many people still waiting to get vaccinated, so I think a big question for them is the J&J vaccine still safe to get?
Yeah, I mean, I think, by and large, and for the people who've already gotten it, I think the message is that luck is on your side because it's less than 1 per every million. So, for the vast majority of people, this is completely safe. They will be protected from COVID. In terms of as we go forward, we do need just more information from the FDA and from the CDC. We need to compare it to some of the reactions that have been seen with the AstraZeneca vaccine in Europe, which is sort of similar to this vaccine. And we need to get an understanding of when this is safe. But I think that the FDA took this step out of an abundance of caution to just learn more about how best to manage this.
There are a number of people in our state, in fact, 100,000 people here who have gotten the J&J vaccine. For those people, what do you say to them? And is there anything that they should be looking out for in the coming days, especially if they just got it recently? This includes some of our colleagues right here. We know a lot of people who have gotten this vaccine.
Absolutely. I mean, I think, first of all, again, there were 100,000 people who got it. Based on the numbers that we've seen, there's a pretty good shot that not one of them will have any issues. So I think the key thing is just to watch out for a really bad headache, blurry vision, fainting or loss of consciousness, seizures, things of that nature. And in terms of recommendations, I would just say stay as hydrated as you can. And these reactions were only seen within 2 weeks of getting the shot. So once you get out of that window, the chance of anything happening is really, really pretty much impossible.
One more question before you go, and quickly here. What about people that cannot have the Pfizer or Moderna vaccine? J&J is their only option. What do they do? What do you recommend?
Yeah, I think we still need some more answers to see if it is possible that we can administer the Moderna or the Pfizer vaccine to them in a way that's safe. I think that we chose the J&J because we had an option, and now if we don't have that option, we have to figure out what we can do to make the mRNA vaccines as safe as possible for people who may have had a little bit of a rough go the first time around.
Well, we certainly appreciate you being with us and giving us answers. I know we're going to have a lot of questions in the days coming, but we appreciate you being with us. Dr. Ohm Deshpande of Yale New Haven Health, thank you so much.
Happy to be here. Thank you.